Wait a minute while that happens. And I'll say good morning. What else can you say at events like this? If we were doing this face to face, we'd say there's no fire alarm planned. So if an alarm does go off, that's your own toast that's burning. So I'm sure you can sort that out. As I said, my name is Graham Duxbury. I'm the Chief Executive of Groundwork, and this is the first in a series of short briefings that we're putting on to explore issues that we're trying to address as a charity through our strategy, and looking at the ways in which some of the business partners that we work with are similarly trying to address those self-same issues. And I'm delighted today that we're being supported by the Cadent Foundation for this first in the series. And you will shortly be hearing from Julia, the director of the Cadent Foundation. And after that, my colleague John, who'll be bringing things to life with a few examples of how this work plays out in one of the areas in which we're operating, which is Blackpool. So these are intended to be very informal gatherings, informal sessions. So feel free to contribute how you like. There'll be some time at the end, hopefully, for any questions that anybody has. You feel free to interact in the chat, or if you just want to sit and listen, have a cup of coffee, and think about it and contact us later, that's perfectly fine as well. So my job here is just to do a little bit of introduction. So Gary, if you can just move the slide on. I just want to give you a bit of background for those who may be new to us, and talk about where we came from as a charity and what we're trying to do. So we began life about 40 odd years ago. Our charity was set up against a backdrop of economic decline caused by industrial restructuring. But it was also a time when there were the first stirrings of consciousness about things like global warming and climate change. And our mission at the time was to support communities to address the physical signs of that decline, especially the quality of the local environment, but then to use that as a springboard for social and economic recovery. So the principles that underpinned everything that we did back in the early 1980s were that we did nothing on our own. So big structural problems like that can't be addressed by a single organization. It needs a partnership approach. It was about putting people first and providing capacity building to people and communities so that they could become the architects of their own solutions to the challenges that they were facing in local areas. And it was absolutely about getting things done. It was about practical action. It was about being pragmatic. It was about rolling up sleeves, turning ideas into action so that people could see and feel a change going on in their local area, and then using that as a way of kind of building confidence, building capability, so that people could go on and tackle bigger issues thereafter. Then move the slide on again, please, Gary. So those principles, I think, have remained over the last 40 odd years, even though an awful lot has changed around us. So we're still focused on places, the physical environment of those places, but also the social infrastructure of those places. So the spaces and places and facilities that people and communities have to meet and organize and address their own challenges. We're still focused on recovery and regeneration, and in particular, the links between what we do and developing the green economy and helping people find jobs in a net zero world. And we're still focused on equipping and empowering people to take action on the issues that matter to them, and especially issues that are connected with the impacts of climate change and biodiversity loss. Things that people are beginning to feel are impacting very directly on their lives. And the mantra behind everything that we do is that you need to join everything up. So this is about providing kind of integrated solutions to social, economic, and environmental outcomes. Next slide, please, Gary. Just a quick illustration of what we look like and how we operate. So Groundwork's 15 organisations spread around the UK with a national umbrella body, which is the body that I run, and that gives us the opportunity to work collectively at a national scale and do things in all parts of the UK. But it also means we've got deep roots in local communities, a lot to reach into local areas, lots of local networks through those regional and local organisations. And down the left-hand side, you can see some of the numbers that we count as we try and tot up the activity across all 15 parts of groundwork. Next slide. And when those 15 organisations come together and agree a strategy, this is what it looks like on a page. So this is our collective strategy for the whole of groundwork. It sets our priorities and our goals for the next 5 years. It talks about what we want to deliver for communities. It talks about how we'll go about that work, the way in which we'll operate, the commitments that will underpin how we do what we do. And it also talks about how we want to improve our own organisation and our own capabilities so that we can be more effective as a group of joined up charities. We're particularly focused on the right-hand side on 4 goals. So these are 4 areas we've identified within groundwork where we want to either increase our impact, extend our networks, grow our scale, or innovate in order to find new solutions to some of the age-old problems that we're addressing as a charity. Next slide, Gary. And today, we're going to be talking about the first of those goals in particular, which is about helping people overcome hardship and isolation. Now, Groundwork's always been focused on alleviating poverty, on addressing structural disadvantage, and helping people build their social contacts and networks that are so fundamental to our well-being. We're adding to that these days with an understanding that climate change impacts first and worst on those people in society who have least choice, least protection, and who generally add least to the problem in the first place in terms of carbon emissions. So that kind of environmental justice or equity lens is very core to what we're about these days. And we see this when it comes to air pollution and who's most exposed to the risks of that. We see it when it comes to a flood risk and who's got least protection against that. We see it when it comes to access to green spaces and who does and who doesn't access good quality green spaces in their local area. We also see it most obviously and probably most acutely when it comes to our energy bills. And that's one of the reasons why, over the last few years, one of the big growth areas in our strategy has been our service to help people who are experiencing fuel poverty. So we run a service that we call Green Doctor, which is aimed at providing household visits to people who are in vulnerable circumstances, who are experiencing fuel poverty, who just need help with their energy and utility bills. It's about going into people's homes. It's about sitting with them, talking to them about their challenges and their pressures and their issues. It's about fitting practical measures in the home that reduce energy use or water use immediately. But it's also about signposting people to services that they might need, whether that's money advice or debt referral services, or whether it's about health and social care issues. So we have about 197 people around our federation engaged in delivering this service, visiting last year more than 30,000 households in total. And one of the biggest supporters of our work in this space over the last few years has been the Cadent Foundation, to whom we're exceptionally grateful. And I'm really delighted to be joined today by Julia, who's the director of the foundation, who's going to tell us a little bit more about how that looks from their end, but also about some of the other work that the Cadent Foundation is doing in this space. So if I can hand the baton to Julia, that would be great.
Thank you, Graham. So I have got some slides as well. I think Gary's hopefully got those to hand. He's able to share them. Or not. No? I'll carry on anyway.
They'll be coming.
Sorry, I do have them. I'm just trying to find them.
No problem. So I'll give you a bit of background about the Cadent Foundation and how we've come to work with Groundwork in the first instance. So the Cadent Foundation was established in 2019. At the time, we were unsure about what direction we wanted to go in from a foundation perspective, but we knew we wanted to work very closely with a number of charities. Through our business, obviously we're funded through Cadent Gas. We obviously understand the impact of fuel poverty on people in their own homes. Our engineers cross the threshold every single day into people's homes and see firsthand how they're struggling. And they wanted to be able to do more to support those people. You can move on to the next slide, Gary. It's probably easier. Um, one of the challenges of working in an energy business is quite often there isn't a facility to help people, and we go in there and find people with a gas emergency and then have to you disconnect them or tell them that they're going to have to stop using their appliances, which is always quite challenging. But to be able to offer them an alternative to getting some advice around how to manage was really key for what we wanted to be able to do. So we approached Groundwork in 2020, and actually it was John that we first approached, and we were talking about the situation in Blackpool, which led us into talking to a broader range of support that we could offer. So through the Green Doctor programme, we understood that we were able to expand our reach. We had an opportunity to be able to reach across all of our network areas. And for those that may not be familiar, we go right from northwest, sort of South Lakeland, all the way through to North London, and we go from east to west, from West Midlands right across to the east coast of England. So we're looking for an organisation that can actually give us that reach, which was quite challenging at the time. But Green Doctors were able to work with us. We looked at the areas that we were covering nationally, and we looked at our priority services registered data to understand where it is we thought we would be best for us to target. Next slide, please, Gary. So over the past 3 years, we've been working really closely with Groundwork and the Green Doctor programme, and we've had some amazing results. So as of this morning, actually, we've now reached 11,000 households have been supported, over the 1.2 million in cost savings for households. And this comes generally through giving practical advice and also installing solutions into people's property that help with energy efficiency. The output of that obviously is a reduction in carbon savings as well. We have a live data dashboard, which there is a link there if anybody's interested in accessing it through the QR code. But what we're really interested in is understanding the impact that we have for people. And I think that drives our interest even further, understanding exactly how we're helping. And we can then tweak and amend the programme whenever we need to. We've got an amazing team that we work with at the Green Doctors, always open to ideas and suggestions and opportunities in ways that we can be a bit more innovative. And that data helps us to do that. Next slide, please. So born on the success of the past 3 years, we are now entering into a new programme with Groundwork and the Green Doctors, our Stay Warm, Stay Well programme. The impact that we've had from the previous 3 years, we've taken that learning and we're going to look at how we can increase our capacity across our network areas, helping those who are hardest to help and hardest to reach. And to do that, we are going to look at innovation. So we are piloting methods that will help us to reach those harder to help people. So we have a new partnership that we've collaborated with RNIB, which will help Green Doctors be able to help people who are partially sighted and blind be able to access this sort of service. So we understand that many of the people that we are reaching do need that extra support and may have extra needs. So we're hoping to facilitate that through that partnership with RNIB. We want to increase collaboration. So we work closely with Cadent and the VCMA funding that we have through Ofgem. And that helps us to have places like centres for warmth across our networks. And it's great to have centres where people can go in and access support and advice. But what we're seeing more and more is people need that extra layer of support. So we want to connect up the Green Doctor programme with our Centres for Warmth. So when they do need to have somebody who can visit them in their home and help them with the day-to-day sort of practical things around, setting your central heating timer or helping them with energy efficient measures, they have that route in. We also want to collaborate more with our other partners that we work with, such as people like Citizens Advice, who do a lot of income advice and financial help. So again, connecting green doctors with our citizen advice projects, I think again will give us that sort of wider net of being able to support people and do it quickly as well, because often we find people in extreme situations and they need support very, very quickly. So the 2024 programme going onwards is about building capacity. It's about also creating employment opportunities. So I'm really delighted that we're able to have the Green Doctor Academy, which is launching this year. That will allow 35 people across the next 3 years to have an opportunity to train to become a green doctor, but also to do it almost like an apprenticeship so that they actually feel supported through that programme. And at the end of it, we'll have more green doctors out there being able to support more people, which is the aim of this. But we also wanted to reach into more diverse backgrounds because we recognise that there are opportunities, I suppose, across the networks where not everybody is coming forward for support and advice, and that may be because they do need that extra to see themselves, I suppose, through the Green Doctors. So the Green Doctor Academy will be able to do a lot of that for us. So I don't have an awful lot more to say, but other than huge gratitude to the Green Doctors for working with us and being innovative. And I'm looking forward to the next 3 years of working with Graham and the team. So I'll hand over to John.
Thanks.
That's brilliant. Thanks, Julie. I just a quick segue because it's my job and I should do it. So I just want to introduce John, who's our director of programs that happen across all of Cheshire, Lancashire, and Merseyside, who's been instrumental in helping us grow the Green Doctor service, but will also give us a flavour of how this looks at a very localised level through the lens of the wider work that we're doing in Blackpool. John, sorry to barge in.
That's great, thank you. There are some slides, but I'll start talking. There you go. So I'm going to kind of try and place some of the work that we do within a specific location within groundwork. So the area that we're going to be talking about today is Blackpool, and there's a specific area of Blackpool which is called Grange Park, where we host a number of our services. So I guess a bit of background to Grange Park. So it's a large housing estate that's on the periphery of the town, post World War II development, and during the 50s up till about the 80s, 90s, it was a place that had a lot of community infrastructure. It had pubs, it had community centres, it had churches, it had village hall, it had a village hall. And what you've seen over the last 20 or so years has been a significant erosion of that community infrastructure that resulted in a big estate that was kind of cut off from the town because of its proximity to it, but also lacked the spaces within the housing estate for people to feel like they can be part of a community. So if you flick on to the next slide, please, Gary. So there was a building on the estate, which you can see at the bottom right of this photo. That's it was called At the Grange. It was formerly a city learning centre that didn't really fulfil what it was set out to do, and became a bit of a ghost space within the estate. So the estate spreads to the north and the south of this photograph. And it fundamentally became a council outreach office. So there was no use for local community, and it became a place that the community were frustrated with. So working with the local authority and working with community partners across Blackpool, we went through an extensive consultation phase to look at what the place could be. So physically, the building transformed, but also the ethos of the building changed significantly. It became a hub for local community where local community have got a say in what goes on there. It's still owned by the local authority, but it's managed by Groundwork on behalf of the local community. So it's a real shift in how that building is perceived with local people. And now there are over 100 different organisations come in and use that space each year, delivering different activities and services, working in partnership both across the estate, but also across different sectors. So we have statutory services, we have voluntary sector organisations, education provision, all happens within this building. And all of the activity that happens within the building is directed by the local community. So if you skip on the next slide and the next one, please, Gary. So in terms of some of the programs that operate from the building when we're looking at hardship and inclusion, so there's a community cafe within the building. Groundwork operate that. We employ people that live on the estate to run that cafe, and it provides fresh, affordable meals to the local people within their community. We provide discounted hot meals as part of a community meal on a weekly basis. There's a food pantry that runs linked to the cafe, providing affordable food shopping for those that can't afford to shop in normal places. And we also have a program of cook and eat sessions, so teaching families how to cook, both cooking healthy and also cooking on a budget. Next slide, please, Gary. So also when we're looking at hardship, we run under the theme, under a program theme called Winter Warm Club. We run a program that is about financial hardship. So within that program, we have the provision of our Green Doctor service. We have a free-to-use community laundrette, which came out of consultation with people that were accessing our Green Doctor service over a number of years. One of their concerns with rising energy bills was cleaning and drying clothes, particularly during the winter months. So we knew that houses weren't putting heating on, but there were wet clothes within properties during that time, which adds to damp and mould. So again, through consultation, we looked at how we could tackle some of those issues and bring some of those concerns, address some of those concerns, within the community centre. We also offer budgeting support. There's programs like a winter coat redistribution program, and we also offer one-to-one counselling. So that links with an accredited counsellor that sits within our team, but also within that building, the registered social housing provider is co-located within that space. So we work closely with them to tackle housing issues on the estate. Next slide, please, Gary. So from wider wellbeing perspective, we run a number of physical activity programs. So there's circuits, there's chair-based exercises, there's a number of different dance and movement classes. We run mental health support groups. So there's groups like Andy's Man Club that come in and use the space. We've got a group supporting veterans, and also a group that's targeting support for teenagers within the local area. And also from a health wellbeing perspective, we run a number of NHS clinics from the space. So because the space is open and it's accessible and people come in and use that space, services like the NHS want to interact with that user group in a space that is accessible to them. So the NHS run weight management, health checks, smoking clinics, and specific targeted groups that are for the local population, which makes it more accessible for people to get to. Also from an NHS perspective, they're out delivering within the community. Next slide, please, Gary. At the back of the physical building, we run a community farm called Grow Blackpool. So that's been open for 6 years now. We run open access volunteering linked to community food growing and to horticultural therapy. Next slide, please, Gary. Over a period of 3 years, so these stats were over a period of 3 years where the project was supported through National Lottery funding. We worked with 432 volunteers and grew over a ton of fruit and vegetables. Those fruit and vegetables were either used in the community cafe, distributed through the food pantry, or given to volunteers that participated in that. We also undertook a 6-month assessment of the impact of the project with public health team in Blackpool Council, and that showed the key impacts on the project were linked to both change in diet, change in confidence, and building resilience, and that kind of creating social and practical support. Grow Blackpool is a place that provides that within the setting of the wider Grange Community Hub. Next slide, please, Gary. And another project that we deliver through the Grange is around school holiday support for local families. So the holiday activity and food programme, which is run, I think, across all local authority areas. Our approach to this is slightly different. So rather than just working with the school-aged children on that project, we work with whole families. So that again is about building relationships between families that live on the estate, supporting them during school holidays to access food, but also activities that they wouldn't be able to access independently. So providing that support and building relationships within communities through family support is important to us. And next slide, please, Gary. And then I guess something else that we do a lot of within the Grange is big celebration events. So if there is anything that's got national significance, whether it's a royal wedding, whether it's Christmas, whether it's just somebody on the estate is turning a significant age, we'll pull together a celebration around that, because that brings local people together. It helps to build connections, create relationships, and tackle some of the issues around isolation. And we often find that an event like that might be the first time somebody comes to the Grange, and then they start participating in other activities and they start to build their confidence. They start to tackle some of the issues that might be causing either their financial hardship or their isolation. Next slide, please, Gary. So this is the last thing I want to say about the project, and it's more about the importance of hubs. So from our experience, hubs demonstrate a real long-term commitment to making neighbourhoods better. So very much a place-based focus. They create physical spaces for people to come together and access different levels of support. They integrate community decision-making within them so that spaces and hubs are responsive to community needs that are identified by the local people, not just identified by external organisations. They help us to build partnerships, both within the voluntary sector, but also with the public sector and private sector organisations. And they also create spaces where you can be present within them without having a need to be there. So you don't need to be enrolled on a project to come to At the Grange. You can just come, and there is a library in there, there's a cafe in there. It's a place that is a welcoming, warm space. And we quite often find that openness provides somebody the opportunity to come in and then start to eventually access the support that's available. So from my perspective, if there are organisations out there that are interested in learning about how we operate the Grange, would like to come and visit us so we can share our experiences with them, then we'd be more than happy to do that. We think that the model of community hubs creates a significant impact, and the more of them that we can have in the neighbourhoods where they're needed, the better. Thanks, Gab. Thanks, Graham.
Brilliant. Thanks very much, John. So we promise not to take up too much of anybody's time first thing in the morning. If there are any questions that anybody wants to throw at any of us, do feel free. as in the usual fashion as you do on Zoom. If there aren't, then you know where to get hold of us. There are other briefings taking place about other aspects of our strategy. So we'll be pushing out invitations to those on social media. Other than that, I will say thank you to Julia for taking the time to join us. Thank you to John for your contribution. I'll wish you all a good day and hopefully see you somewhere down the road. Thanks very much, everybody.
Thanks, Graham.
Bye.
Bye.